Welcome to the mini lecture on how to assign inpatient procedure codes using Volume 3 of your ICD-9 codebook. Hopefully by now you're a little bit familiar with the Volumes 1 and 2 that we used in diagnosis coding. And just a reminder that the diagnosis or the condition is the reason the patient was being seen in the first place. With procedures, it's more of what happened. Did they have a procedure done? An operation, a test, imaging, anything like that. And just remember that the Volume 3 in ICD-9 is used for inpatient-only encounters, such as in an acute hospital stay. Before we go too far, it's important to recognize the difference between the procedure and diagnosis terms. This is where your medical terminology comes into play. We'll practice with some simple words. Appendectomy, would that be a procedure or diagnosis? That would be a procedure, removal of the appendix, and you will use Volume 3 to find that. Appendicitis? That would be a diagnosis, and that would be found using Volumes 1 and 2. Biopsy. That's a procedure. You could have a biopsy done of your skin or of an organ. How about arthrosis? Well, that's a degenerative joint condition, so that would be a diagnosis. And arthrotomy? That would be a procedure. If you're not familiar with these terms, look them up. So let's move on to Volume 3 procedure code. At this point, if you need to pause the recording, do so and locate your index to procedures and your tabular list, which will be found in the very back of your codebook after the appendices in Volume 1 and 2. In the tabular listing, things are very similar to what we saw on the diagnosis side. There's a couple new notes which are with and without. If you have a with, for instance, a graph is with included with a procedure code, then no additional code for that graph is required. Likewise, if there's a without indicated, you would need an additional code for that procedure. Other instructions are very similar, such as excludes, includes. Also note the format. The procedure codes are designated by 4 digits separated by a decimal point after the second place. For instance, 33.22. Very important when you're listing procedures to put the decimal point in the correct place so they don't get confused with the diagnosis code. Our first step is identifying the main term. This should look very familiar. Not the anatomical site and not the adjective for the procedure, but maybe an eponym. So our basic steps is we locate the main term, we follow directional terms and notes, review the procedural statement to locate any additional information, subterms, modifiers, and then verify the code in the tabular list. Remember, we never ever code just from the alphabetical listing. A good rule of thumb is also to look up and down plus and minus 3 codes in the tabular list to ensure you have the proper procedure. Here's an example of how to code. An incidental appendectomy. The main term would be appendectomy. Couple things to remember here. Once you locate that in the alphabetical index, we see appendectomy. You see that in parentheses is with drainage. Remember, that's your non-essential modifiers and is included with the appendectomy code. We have 2 choices for incidental, 4719 or laparoscopic 47.11. We don't have any indication that we used a scope, so we're going to go with the incidental code of 47.19. And now we're going to go to the tabular index. So here's a sample of what the page of the codebook looks like. When we get to 47.1 in the tabular index, you can see that there is our code, other incidental appendectomy. And this one actually has a definition of what an incidental appendectomy is. So our proper code is 47.19. Let's try another one. How about endoscopic ligation of esophageal varices? So the first thing we're going to do is search for the main term ligation in the alphabetical index, and then the subterms varices and esophageal. And here's what it looks like in the alphabetical index. Again, pause if you need to and find this in your codebook as well. So you can see the code we're going to look for now will be the 4233 in the tabular index. We go to the tabular and we look it up and we see right here 4233 endoscopic excision or destruction of lesion of tissue of the esophagus. So our esophageal varices is included here. And also note that there's other procedures that are included as well. So remember that the ICD-9 codes, procedure codes lack specificity. So in general, the information that you need to assign procedure codes will be the type of procedure performed, the approach, and the anatomical site. However, it's important to read all notes and codes carefully. You will need to read and interpret an op report to ensure proper codes are signed.